analysis of the SEER database. It will be presented by Oluwasegun Akinini.
Hi, everyone. Thank you for the opportunity to present findings from our study titled Secondary Malignancies Following Primary Cervical Cancer Diagnosis, an analysis of the SEER database. I'm Dr. Oluwasegun Akinini, a Senior Research Associate at the Howard University College of Medicine, Washington, D.C. We have no disclosures. Cervical cancer remains one of the commonest and most devastating cancers among women worldwide. And in the United States and other developed countries, the incidence have plummeted in recent years. This is due to the availability of vaccination against human papillomavirus and also the regular Pap test screening. However, it continues to be a significant cause of mortality and economic burden. In 2018, 13,000 new cases were reported, while about 4,000 women died from the disease in the same year. While the mortality following primary cervical cancer continues to decline, a small proportion of women who develop primary cervical cancer progress to develop second malignancies. Little is known about these women. The objective of the present study is to determine the common second malignancies following primary cervical cancer diagnosis. The second objective is to determine the factors that predict a prolonged latency interval and the association between these factors and overall patient survival. The latency interval is the time from primary diagnosis of cervical cancer and a second primary cancer. We utilize the SEER database for this study. The SEER Cancer Registry uses a coordinated system of cancer registries located across the United States to collect data on cancers reported in 19 United States geographic locations. These areas are about 35% of the US population and are accepted representatives of the demographics of the entire United States. We conducted a retrospective analysis of all patients who develop a primary cervical cancer malignancy and identified a subset of these patients who subsequently develop a second primary cancers. We determined factors that affect the prolonged latency interval and also factors that affect the overall patient survival. The baseline distribution of the study variables stratified by patient race shows that 27.6% of Hispanics receive a prior chemotherapy in the prior primary cervical cancer compared to 20.5% of whites and 17.2% of blacks. Also, 61.8% of white American women receive surgical treatment, cytoreductive surgeries, compared to 56.2% of blacks and 57.5% of Hispanics. These differences were, however, not statistically significant. 72.4% of Hispanics and 66.4% of blacks and 61.8% of white develop a second primary malignancy within 10 years of the primary cervical cancer diagnosis. Here we highlighted the common second primary malignancies following a primary cervical cancer malignancy. The most common overall malignancies are rectal cancers, which comprises 12% of the total cohort. Surprisingly, while stomach cancers were the commonest second malignancies among Hispanics and other races, which are identified as Asian or Pacific Islanders, stomach cancers were not a significant second malignancy among whites and Black Americans. In our multivariate analysis, we showed the association between study variables and the overall patient survival. Only prolonged latency interval and cytoreductive surgical treatment of the primary cervical cancer were associated with overall improved patient survival, why prior chemotherapy in the primary cervical cancer was associated with a significant reduction in patient overall survival. Some of the limitations of this study include the fact that the CA database does not contain certain epidemiological variables such as BMI and smoking history, which may be linked to cervical cancer outcomes, making it difficult to study the relationship between such exposures and outcomes in our study population. There is also a lack of quality data on socioeconomic status, comorbidities, and insurance status, which began to be collected from 2007. There are also paucity of data on specific chemotherapeutic agents, sequence of treatment, and treatment of tumor recurrence. However, using the CA database gives our study the advantage of a large sample size for studying this small cohort of women. And finally, results from our study can be used to make conclusions about the general United States population, as CA contains a representative and generalizable data. In the present study, Hispanic women were more likely to have a shorter latency interval, and this requires further studies. The findings of this study may be useful in optimizing screening for second cancers among cervical cancer survivors. And in the future, research is needed to understand the role of tumor genetics in the racial disparities seen in outcomes among cervical cancer survivors. Thank you. I'll be happy to answer your questions.
Thank you, Dr. Alo-Shigan, for this interesting presentation. Unfortunately, Dr. Alo-Shigan could not connect with us, so there will be no questions for the session. We can move to our third presentation, evaluation of a game box for laparoscopic training, a randomized study. And it will be presented by